Welcome to the LMD Podiatry Podcast. Trust us to get back on your feet. Here's your host, Dr. Lauren DeBaccaroff.
Hello, everyone. We are back. Your co-host here, Jeremy Wolf, with Dr. Lauren. Good to see you again, Dr. Lauren.
Good morning.
Good morning. So thanks, everyone, for tuning in. You know, we have a running theme going here, pun intended, and it's my running journey. You know, I was running the other day, and out of nowhere, I just started getting some pain in my ankle and kind of the lower arch of my foot, and it got me thinking about how I'm getting old and I'm breaking down real quickly, but got me thinking about ankle sprains. And I don't really know what that is exactly. So can you maybe explain what a sprain is and how it differs from other foot and ankle injuries?
Sure. So what is a sprain, right? So you have ligaments, right? We have hundreds of ligaments throughout our whole body. And what ligaments do is they hold down bone to bone. So every little joint in your body is held together or anchored with a ligament. And a ligament is just made from this fibrous connective tissue, and it's just supposed to stabilize the joint and hold it together. When a sprain happens, in your case, an injury, what happens is those ligaments, they stretch. So like a regular, boring grade 1 sprain is that you take that ligament and then instead of it being nice and parallel and smooth, all of a sudden it's stretched out a little. You know, you could have a grade 1, grade 2, grade 3 sprain, and you could have a partial tear of your ligament. You have a complete tear. So all those, it's basically nothing is holding the joint anymore.
So, and this could just come, obviously, because I feel like I didn't even do anything to create the injury. This could come from just repetitive motion, doing the same activity, and probably stretching, as we always talk about, would help that in advance.
Well, you could have like if you were running, in your case, you were running, or you're, doing the Stairmaster or biking, or playing tennis, golf, any of those like repetitive things. Pickleball, for example, if your foot's not very stable when you do that motion, if it's not held well in a shoe, for example, or you didn't tie your shoelaces enough. So, eventually that ligament will overstretch. And that's probably why you might not have like a pure sprain, but, the ligament probably was the joint was a little unstable when you were running and it overstretched a little bit. And that's why your ankle was hurting. So that's kind of, a basic way to explain it.
So how can I or someone who's listening differentiate between, because I'm just assuming at this point that maybe because a lot of times you tweak your ankle, you're like, oh, I just sprained it. But how can you differentiate between a sprain and something more serious that could actually require some immediate attention, like a fracture or like a ligament tear or something like that?
So it usually depends how long the pain takes to go away, right?
So how long should it take then? Because it's been like a week or so, and I still get it when I run.
So if it's been a week, you should see your local foot doctor.
Okay, you got to get me in on the calendar. I got to come see you.
So that's what happens when patients have a trauma. They have a trauma, they have pain. If it doesn't go away within a week or two, then they come in to get evaluated. I always get an X-ray to make sure nothing's broken, and then if the X-ray is broken, if nothing's broken on the X-ray, I do a quick ultrasound, and the ultrasound will show me if there's a ligament, if there's a ligament sprain, if there's a tendon sprain. Your tendons can overstretch, your ligaments can overstretch. Lots of different things can happen. The most common thing I see in your case for a runner, you guys usually get a capsular sprain. A capsular sprain is like the second joint underneath the pad of your foot. That one is where you land all the time when you run. So a lot of times, if you guys are not protecting the area, you can have a little sprain or a tear there.
Yeah, I felt a lot of the pain and discomfort again out of nowhere. I was just running, and all of a sudden it was around the lower ankle area into the arch of the foot, and I kept going because I was like, oh, I can get past this. And then I got done, and now I'm getting ready for a 5K, I think next weekend. And I'm wondering.
That sounds like a tendonitis, Jeremy.
Oh, yeah.
Yeah, you have the posterior tibial tendon. It courses through the inside of your ankle, attaches into your arch. And what happens with that is the main tendon that holds up your arch. So if you're wearing shoes or insoles that aren't giving you enough support, and then you're a runner, so that that repetitive motion probably made your tendon tired, and that's why it probably hurts worse at the end of the day.
Yeah. Well, I mean, it just depends, right? When I walk around barefoot, it starts to hurt. But when I have the shoes on and I walk, it doesn't hurt as much. But if I start running, inevitably after, a few hundred yards, I start feeling a little bit of pressure on the bottom and it just gets worse.
Right.
The more I go.
It's just like I kind of, analyzed from where your pain was, I'm assuming that, but like, that's why you should always come in, because it could be anything, and each thing is obviously the best is rest, but each thing is treated very differently. You know what I mean? So like if it's just like a tendonitis, or you have like an inflamed tendon that's tired, the best, for example, the best thing to do is just rest it and ice it and compress it for like 2-3 weeks. And then if you do have like a serious sprain, that usually requires some sort of immobilization for up to 6 weeks. So, wearing a brace or something like that. A lot of people get ankle sprains. I always recommend wearing a brace for 6 weeks, because, it takes that long for your body to lay down the foundation for the ligament to repair itself. So, again, there are so many types of injuries, and they all act differently. They all need to be treated a little differently. So that's why it's really important to, if you suspect some pain, hint, Jeremy, if your pain's not going away after a week or two, no matter what you do, it's best to come in and get some imaging and, have an examination by your local podiatrist, hint, me. So we can make sure that you're pain-free.
I'm glad I know a good podiatrist, because I think a lot of people suffer from what I do, which is to say, I think it's probably an ego thing more for men. I get a little pain, and I think in my mind, I'm like, oh, I'm sure it's nothing. Like, I don't need to go to see a doctor. I can walk it off. And then maybe it isn't something that's that severe, and you keep putting pressure on it. And then all of a sudden that turns into a more severe injury. And then you're out of commission for a while. So, I think a lot of us are like that.
I've been having patients that they've been living with their pain for over a year and a half. And then when I do an exam and I see, all the stuff, I look on the inside, guess what? They're like full of scar tissue, and it's like harder to repair that. They're less likely to respond to basic treatment. You know what I mean? So, pain is like a really big indicator by your body, like, please do something about me. So a lot of people think that just because, it'll go away. And then when it doesn't go away, they don't want to do anything about it, because they know they have to keep walking, and they could just keep walking on their injury. So then it makes it worse.
Yeah.
So, do yourself, to everyone out there in podcast land, good neighbors, don't ignore your pain, because it can be something simple, and then it could be something severe. So you don't want it to end up in some type of complication.
All right. Well, I am definitely going to schedule a time to come see you to get this looked at. And I actually haven't been to a podiatrist, and I can't even remember the last time I've been in. So it's probably a good idea to get a little bit of a checkup. So you'll be hearing from me for sure.
All right. Do you want to know anything else about sprains, or did we cover everything?
I think I got a pretty good handle, unless there was anything else that you wanted to share.
No, I mean, it's pretty basic. Just it's important to protect your feet with wearing the right shoes, with the right inserts. And if you have an injury and want to keep going, there are ways to just, wrap your ankle and wrap your feet, wrap your toes. And
Kinesio tape, right?
Yeah.
I'm going to tape it. That's what I'm going to do. I'm going to tape it after I see you. If you give me the green light to run the 5K, I'll tape that puppy up. Get it ready.
Yeah, it's so versatile how we treat it. There's medicine is so advanced today. They didn't have kinesio tape 100 years ago, and people kept walking on their injuries, and We didn't have the shoes that we had, 100 years ago. So everything is really different. And the one thing I will say, that the most common cause of everybody's injuries today is because the shoes today are made for foot size and not for foot type. Whereas 100 years ago,
they were fitted for the foot.
Fitted. Every person had their own custom shoe.
You had to go see a cobbler to fit you for a pair of shoes,
exactly,
right?
Exactly. And
we need to bring back the cobbler. Let's go.
We need to bring back the cobbler.
Hashtag.
I went to like a museum and I saw like all these like shoes, and you could tell like each person had a unique shape to their shoe, as do all we today. But all the shoes today are like massively produced.
Yeah.
Was made for cheaper materials that wear out very frequently, and a lot of people just aren't aware about that. They have no idea, and they don't know why they get all these aches and pains.
I mean, it kind of makes sense, right? We spend quite a bit of time on our feet. It makes sense to have a pair of shoes that supports them properly, obviously.
Yeah, it's hard to come by. I do lots of shoe education in my office. So keep your feet, protected, everyone.
All right, sounds good. Thank you, everyone, for joining us, and we will catch you all next time. Everyone, have a wonderful day and take care.
Thank you for listening to the LMD Podiatry podcast. For more information, visit lmdpodiatry.com. That's lmdpodiatry.com. Or call 954-680-7133.